Hello and welcome to the Deep Microbiology channel. Today we have a short video on the interpretation of serological tests for hepatitis B virus. Let's dive in. Before moving on to serological interpretation, let us first review the main serological marker for hepatitis B virus, HBV. The first and most important marker is the hepatitis B surface antigen. It consists of three co-terminal envelope proteins: large hepatitis B surface antigen, middle hepatitis B surface antigen, and small hepatitis B surface antigen. Hepatitis B surface antigen is the first antigen to appear in the blood following HBV infection, making it the hallmark of infection. It can be detected at high levels in the serum during both acute and chronic stages of the disease. This antigen is also used in the production of the hepatitis B vaccine. The hepatitis B surface antigen may be transiently positive for 2 to 3 weeks after vaccination, but this finding is clinically insignificant and does not indicate an active infection. The second serological marker is the antibody against the surface antigen. Detection of this antibody in the serum indicates that the individual has either been successfully vaccinated against hepatitis B, since, as mentioned earlier, the vaccine is made from hepatitis surface antigen, or if it appears together with core antibody, it suggests immunity resulting from a past hepatitis B virus infection, which I will discuss later in more detail. The third serological marker is core antigen. This protein made up the capsid of hepatitis B virus. It is an intracellular antigen expressed in infected hepatocytes that cannot be detected in serum. Instead, the immune system produces antibodies, anti-HBC, against it, which can be detected in blood. Core antibody is a key immunological marker for hepatitis B virus, HBV infection. It appears in the blood during both acute and chronic infections and remains detectable for life, even after recovery. Therefore, it is considered the permanent record or criminal record of hepatitis B virus infection. Core antibody exists in two classes, IgM and IgG. IgM appears during the acute phase of hepatitis B infection and usually disappears within about 6 months, while IgG persists and indicates chronic or past infection. In routine lab tests, they don't usually test IgG anti-HBC separately. Instead, they measure total anticore antibody, which includes both IgM and IgG, which reflects any past or present exposure to hepatitis B virus, while testing IgM alone specifically signifies a recent or acute infection. Also, core antibody is only serological marker can be detected during the hepatitis B window period. What is window period? The window period is the gap between the disappearance of an antigen and the appearance of protective antibodies against that specific antigen. Here the HBsAg disappears from the blood because the immune system has begun clearing viral particles, but anti-HBs antibodies have not yet appeared because the B cells require time to produce detectable levels of antibodies. On the other hand, the immune system produces the hepatitis B core antibody IgM first because core antigen is the earliest antigen presenting during intercellular viral replication, which is why it appears sooner than the surface antibody, anti-HBs, and persists for life. The other serological marker is E antigen, is a soluble, non-particulate nucleocapsid protein produced in liver cells where the hepatitis B virus is actively replicating. It is secreted into the blood, and its presence usually indicates a high level of viral replication and high infectivity. When hepatitis E antigen is absent, it generally suggests a lower viral load and reduced infectivity. However, in some cases, particularly with pre-core or core promoter mutations, E antigen may be absent despite high levels of hepatitis B virus DNA, meaning the person can still be infectious. The presence of E antigen is therefore associated with a higher risk of hepatitis B virus transmission, such as through needle stick injuries or mother-to-child transmission. The last serological marker is anti-HB. It indicates host immune response against HBAg, usually associated with reduced viral replication, lower HBV DNA titer, and reduced infectivity, but also present in those in HBAg-negative viral mutation. Besides serological tests, HBV DNA testing is a direct and quantitative marker of viral replication. It is used to assess disease activity, guide antiviral therapy, and monitor treatment effectiveness. Now, let's review the interpretation of hepatitis B serological tests. Positive HBsAg, negative anti-HBs, positive total anti-HBc, and positive IgM anti-HBc indicate an acute hepatitis B infection. The presence of HBsAg confirms an active infection, while IgM anti-HBc positivity specifically signifies that the infection is recent or acute rather than chronic. Positive HBsAg, negative anti-HBs, positive total anti-HBc, and negative IgM anti-HBc indicate a chronic hepatitis B infection. The presence of HBsAg shows ongoing infection, while the absence of IgM anti-HBc suggests that the infection is not recent, confirming a chronic rather than acute infection. While negative IgM anti-HBc usually indicates chronic hepatitis B, IgM can become positive in chronic infections during severe disease flares or reactivation. In such cases, the presence of IgM does not necessarily indicate a new acute infection, but rather an active flare of a chronic infection. Negative HBsAg, positive anti-HBs, positive total anti-HBc, and negative IgM anti-HBc indicate a resolved hepatitis B infection. The absence of HBsAg shows the infection is no longer active, anti-HBs positivity indicates immunity, and positive total anti-HBc confirms previous exposure to the virus, as these antibodies persist for life. A test result of negative HBsAg, positive anti-HBs, and negative total and IgM anti-HBc indicates immunity from hepatitis B vaccination. This pattern shows no active infection, negative HBsAg, and no prior natural infection, negative anti-HBc. The positive anti-HBs antibodies alone reflect immunity from successful vaccination. A protective level is generally considered more than or equal 10 milliliters international unit per ml, but this can decline over time, sometimes requiring a booster dose. Negative HBsAg, negative anti-HBs, negative total anti-HBc, and negative IgM anti-HBc indicate a susceptible individual who has never been infected or vaccinated, or a previously vaccinated person whose anti-HBs levels have declined over time. Negative HBsAg, negative anti-HBs, positive total anti-HBc, and negative IgM anti-HBc. Results can have several interpretations depending on the case. Possible explanations include past infection with waning anti-HBs levels, occult hepatitis B infection, the presence of HBV DNA in the liver or blood of a person who is negative for HBsAg. This occurs when viral DNA persists despite the absence of HBsAg, making the infection occult or hidden from standard tests. A false positive anti-HBc result, passive transfer of anti-HBc to an infant born to an HBsAg positive mother. Infection with a mutant HBsAg strain that is not detectable by routine laboratory assays. Thanks for watching. If you enjoyed the content, don't forget to subscribe to Deep Microbiology channel and turn on notifications to stay updated.